When people think of Sjögren's syndrome, the focus is usually on dryness, fatigue, or joint pain. These are the symptoms that affect everyday life, the ones patients notice immediately. But beneath the surface, there is a much more serious risk that too often goes unspoken: lymphoma, a type of blood cancer. While not every person with Sjögren's will develop it, the risk is significantly higher compared to the general population, making it one of the most important complications to understand. Why does this happen? Sjögren's is an autoimmune disease, which means the immune system is constantly activated, producing antibodies and stimulating immune cells, especially B cells. Over time, this chronic overstimulation increases the chances of abnormal changes that can lead to cancer. Lymphoma in Sjögren's typically arises from these very B cells, the ones meant to protect you, but that, under constant pressure, can begin to grow uncontrollably. For patients, this reality can feel frightening, but it is not meant to inspire fear. It is meant to inspire awareness. Knowing the risk means you can watch for signs, work closely with your doctor, and take steps to detect problems early. Most lymphomas caught in the earliest stages are treatable, and outcomes improve dramatically when vigilance is part of your care. In this video, we're going to break down the link between Sjögren's and lymphoma in a way that is clear and practical. We'll look at how autoimmune activity raises the risk, what the actual numbers are, what symptoms should never be ignored, how doctors monitor for warning signs, and what steps you can take to protect yourself. Let's begin with the science. How exactly does Sjögren's increase the risk of lymphoma? 1. How Sjögren's increases the risk of lymphoma. To understand why lymphoma is more common in people with Sjögren's, we need to look at what is happening inside the immune system. Sjögren's is an autoimmune condition, which means the immune system doesn't switch off the way it should. Instead, it stays on high alert, constantly producing antibodies and stimulating immune cells. Over time, this state of chronic activation creates the perfect environment for mistakes to happen. The key players are B cells, a type of white blood cell. In healthy people, B cells produce antibodies only when needed, and then they rest. In Sjögren's, B cells are pushed to keep working, producing large amounts of autoantibodies, proteins that mistakenly attack the body's own tissues. This constant demand puts B cells under stress, and with stress comes risk. The more often cells divide and multiply, the more chances there are for mutations to occur. Some of these mutations can give B cells the ability to grow unchecked, which is the beginning of lymphoma. Another factor is the environment inside the glands affected by Sjögren's. Salivary glands, in particular, often become sites of chronic inflammation where B cells gather in clusters. These clusters sometimes form structures that resemble miniature lymph nodes, called ectopic germinal centers. While these centers are meant to support immune activity, in Sjögren's, they provide a breeding ground for abnormal B cells to survive and expand. This localized environment increases the chance that one of these cells could transform into a lymphoma. Specific autoantibodies also play a role. Research has shown that people with Sjögren's who have anti-Rho SSA and anti-LA SSB antibodies are at higher risk of developing lymphoma. The presence of these antibodies signals an especially active autoimmune process, which correlates with higher cancer risk. It's important to emphasize that not everyone with Sjögren's will develop lymphoma. The majority of patients never will. But the risk is real, and it is higher than in the general population. For patients, this means vigilance is necessary, not panic. Knowing how the disease creates this risk empowers both you and your doctors to stay alert to early warning signs. Next, let's break down the actual numbers. How much higher is the risk? And what do studies show about the likelihood of lymphoma in Sjögren's patients? 2. The numbers. Understanding the actual risk. When patients first hear about the connection between Sjögren's and lymphoma, the natural question is, how likely is it really? The good news is that while the risk is higher than average, the majority of people with Sjögren's will never develop lymphoma. Still, understanding the numbers helps put this risk into perspective and reinforces why monitoring is so important. In the general population, lymphoma is relatively rare. The lifetime risk of developing non-Hodgkin lymphoma is estimated at about 2%. In people with Sjögren's syndrome, studies suggest the risk may be 5 to 10 times higher, depending on individual factors. That translates to an estimated lifetime risk of around 5 to 10%. While that is a significant increase, it still means that most patients will not face this complication. Certain subgroups of Sjögren's patients carry more risk than others. Those with persistent swelling of the salivary glands, enlarged lymph nodes, or the presence of specific autoantibodies such as anti-Rho SSA and anti-LA SSB tend to have a higher chance of developing lymphoma. Low complement levels in the blood, particularly low C3 and C4, have also been associated with greater risk. These are measurable markers that doctors can track over time to identify higher-risk patients. The type of lymphoma most commonly linked to Sjögren's is non-Hodgkin's B-cell lymphoma, especially a subtype called mucosa-associated lymphoid tissue lymphoma, or MALT lymphoma. These usually develop in the salivary glands or other mucosal tissues where chronic inflammation from Sjögren's is most active. Because these lymphomas often start slowly, they may be detected early if patients and doctors stay vigilant. It's also worth noting that the risk of lymphoma increases with disease duration. The longer someone has had Sjögren's, the greater the chance of developing complications. This is why ongoing monitoring, even years after diagnosis, remains critical. The bottom line is this: while the numbers show a clear increase in risk, lymphoma in Sjögren's remains the exception, not the rule. Awareness and regular checkups shift the odds even further in your favor by making early detection possible. Now that we understand the numbers, the next step is to recognize the warning signs. What symptoms should never be ignored? And how can you tell when it's time to see your doctor immediately? 3. Warning signs. Symptoms that should never be ignored. One of the most important things for people with Sjögren's to understand is that lymphoma often develops quietly. It may not announce itself with sudden pain or dramatic changes. Instead, the early signs can be subtle and easy to dismiss. Recognizing these warning signals early is what allows doctors to step in before the disease progresses too far. The most common red flag is persistent swelling of the salivary glands, particularly the parotid glands near the jaw. While temporary swelling is common in Sjögren's due to inflammation, swelling that does not go away, or that gradually increases over time, should always be checked. This is especially true if the swelling feels firm, uneven, or affects only one side. Another warning sign is unexplained enlargement of lymph nodes. Lymph nodes are small, bean-shaped structures in the neck, armpits, or groin. While they can enlarge temporarily during infections, nodes that remain swollen for weeks or months without clear reason may signal lymphoma. Systemic symptoms also deserve attention. Unexplained weight loss, night sweats, and persistent fevers are often grouped together as B symptoms in lymphoma. These changes reflect the body's struggle against uncontrolled cell growth and should never be ignored. Fatigue is a symptom that overlaps heavily with Sjögren's, but when it becomes more profound or sudden, especially when paired with other warning signs, it raises suspicion. Likewise, new or worsening anemia, frequent infections, or unexplained bruising may point to bone marrow involvement. Patients should also pay attention to changes in their mouth or throat. Since malt lymphoma often develops in salivary tissue, unusual lumps, persistent discomfort, or difficulty swallowing should be evaluated by a doctor. It's important to remember that these symptoms don't always mean cancer. Many of them can be caused by routine infections or by Sjögren's itself. However, the risk of lymphoma in Sjögren's makes it essential not to dismiss them. The sooner evaluation is done, the sooner doctors can rule out or confirm the diagnosis and begin appropriate treatment. The message is clear. Vigilance does not mean living in fear. It means being aware of your body, recognizing when something feels different, and communicating openly with your healthcare team. Early detection often makes all the difference in outcomes. Next, we'll look at how doctors monitor patients with Sjögren's for lymphoma and what tests and strategies are used to catch it as early as possible. 4. How doctors monitor Sjögren's patients for lymphoma. Because the risk of lymphoma is real in Sjögren's, doctors take a proactive approach to monitoring. The goal is not to overwhelm patients with constant testing, but to build a strategy that balances vigilance with peace of mind. Regular follow-up care becomes the foundation for catching problems early when they are most treatable. The first line of monitoring is a thorough clinical examination. At routine visits, doctors check for signs such as swollen salivary glands, enlarged lymph nodes, or changes in the mouth and throat. They may also ask about systemic symptoms like unexplained weight loss, night sweats, or persistent fatigue. These conversations, combined with physical exams, often provide the earliest clues that something may be developing. Blood tests are another important tool. Doctors may look for changes in blood counts, which can reflect bone marrow involvement or shifts in inflammatory markers. Low complement levels, C3 and C4, and the presence of certain antibodies like anti-Rho SSA and anti-LA SSB are known to be associated with higher lymphoma risk. Tracking these markers over time helps build a clearer picture of each patient's risk profile. Imaging studies can also be useful when symptoms raise concern. Ultrasound or MRI may be used to evaluate salivary glands, especially if there is persistent swelling. CT scans or PT scans may be ordered if enlarged lymph nodes are detected. These imaging tools allow doctors to see beyond what can be felt or observed on exam. In cases where lymphoma is strongly suspected, a biopsy is the definitive test. Taking a tissue sample from an enlarged gland or lymph node allows pathologists to determine whether abnormal cells are present. While this step can sound intimidating, it is the only way to confirm or rule out lymphoma with certainty. Importantly, monitoring is not about living under constant fear of cancer. Instead, it is about building a long-term partnership with healthcare providers. Patients are encouraged to report any changes promptly, while doctors use targeted tests to investigate concerns. This shared responsibility ensures that warning signs are not missed. Regular monitoring gives patients confidence. It shifts the narrative from waiting helplessly for something to happen to actively protecting health with knowledge and vigilance. Most patients with Sjögren's will never develop lymphoma, but knowing that your doctors are watching carefully provides reassurance and safety. Next, let's talk about what patients themselves can do to protect their health. Beyond medical monitoring, there are lifestyle and self-care steps that help lower risk and strengthen resilience. 5. Protecting yourself. Lifestyle and medical steps that help. While the risk of lymphoma in Sjögren's cannot be eliminated completely, there are meaningful steps patients can take to protect themselves and improve overall health. These steps are not about living in fear, but about building resilience and staying ahead of problems through both lifestyle choices and medical care. The first step is consistent follow-up with your doctor. Keeping regular appointments ensures that subtle changes are noticed early. blood tests, imaging when needed, and careful physical exams all provide safety nets. Skipping visits, on the other hand, allows small problems to go unnoticed until they are harder to treat. Equally important is self-awareness. Patients know their own bodies best. Paying attention to changes, whether new lumps, persistent swelling, or unexplained fevers, allows you to alert your doctor promptly. This vigilance is not paranoia, it is smart and proactive care. Lifestyle also plays a key role in protecting health. A nutrient-rich diet filled with vegetables, fruits, whole grains, healthy fats, and lean protein helps lower inflammation and supports immune balance. Foods rich in antioxidants and omega-3 fatty acids may provide additional protection by reducing oxidative stress, which fuels abnormal cell changes. Avoiding smoking and limiting alcohol are also critical, as both increase cancer risk and add strain to the immune system. Staying physically active, even through gentle exercise like walking or swimming, supports circulation, reduces inflammation, and strengthens resilience against chronic disease. Stress management cannot be overlooked. Chronic stress keeps the immune system in a heightened state, which is exactly what fuels autoimmune problems and increases long-term risks. Mindfulness practices, meditation, yoga, or even simple breathing exercises can make a powerful difference. Adequate, restorative sleep is equally vital, as it allows the immune system to reset and repair each night. Patients should also keep up with routine cancer screenings recommended for their age, such as mammograms, colonoscopies, and skin checks. These don't directly target lymphoma, but provide comprehensive safety, since autoimmune disease can sometimes increase risks across multiple systems. Finally, emotional support is essential. Facing the possibility of serious complications like lymphoma can weigh heavily. Support groups, counseling, or simply connecting with others who share the same journey can reduce fear and provide encouragement. No one should face autoimmune disease alone. The truth is, most people with Sjögren's will never develop lymphoma, but knowledge, vigilance, and healthy living tilt the balance even further in your favor. By combining medical monitoring with proactive lifestyle steps, you give yourself the best chance at long-term health and peace of mind. Now let's bring everything together with a summary and encouragement, focusing on why awareness of this cancer risk should empower you rather than frighten you. Sjögren's syndrome is a condition that already brings daily challenges like dryness, fatigue, and joint pain. Learning that it also carries an increased risk of lymphoma can feel overwhelming at first. But knowledge is not meant to paralyze you. It is meant to guide you. By understanding the science behind this risk, by recognizing the numbers, and by knowing what signs to watch for, you give yourself the power to act early rather than react late. The truth is, most people with Sjögren's will never develop lymphoma, but those who do often show warning signs that can be caught if both patients and doctors remain attentive. Persistent gland swelling, enlarged lymph nodes, unexplained weight loss, or night sweats should never be ignored. These clues are the body's way of asking for attention. When addressed promptly, they allow for early diagnosis and treatment, which dramatically improves outcomes. Living with Sjögren's also means embracing a proactive lifestyle. A nutrient-rich diet, stress management, restorative sleep, and regular gentle exercise all contribute to lowering inflammation and strengthening your overall resilience. Pairing these daily habits with consistent medical care, routine blood work, imaging when needed, and open conversations with your healthcare team creates a strong defense that supports both your body and your peace of mind. If this video has given you clarity and reassurance, please give it a like, share it with others who may need this knowledge, and subscribe to Active Healthcare for more supportive, science-based guidance. Remember, you are not powerless. Awareness is protection, and your vigilance is a form of strength that empowers you to live fully despite autoimmune challenges.